Hi, my name is Rachel DiPaolantonio and I'm the current PGY1 pharmacy resident for Wilkes University in Weis Markets. I recently graduated from the University of Rhode Island in May of 2022, and I'm from Schnecksville, Pennsylvania, which is actually where the residency is located. So the reason I chose a community-based residency program is that I've been involved in community pharmacy since before I even started my professional years of pharmacy school. I was actually an intern at a local independent community pharmacy named Hartzell's Pharmacy for about 5 years before graduating from pharmacy school. So at that pharmacy, I was able to see a huge range of clinical services, and that's really what got me interested in continuing on in community in the first place. I got to see DPP classes done, I got to see a wide range of vaccine clinics and participate in those. I saw all the counseling opportunities, the opportunities to be involved in MedSync, and just really meaningful patient care. So that was the main reason that I chose to stay in community pharmacy. But during rotations, I also had a rotation at a community pharmacy, another independent called Skip Back Pharmacy. And while I was there, I had a really unique opportunity to get them a CLIA waiver to start doing testing for COVID testing right in the midst of the pandemic. And the process that I started there has now been used to test literally thousands of patients. So I started from the ground up, chose what tests to order, I created the whole procedure, and seeing all of that impact on patients really drew me to stay in community pharmacy. So overall, with all of those experiences while I was still in pharmacy school and prior to graduating, I just really wanted to be able to dive deeper into some of those experiences. I wanted to be trained in DPP, I wanted to be a PPCN pharmacist and be able to do so many clinical services that I'm able to do now as a resident. So the reason that I specifically chose the Wilkes and Weis program was because of one of the very first interactions that I had with Dr. Nicole Pizzino, who's the residency director. I had the pleasure of working with her and the former resident Isabel to do an immunization training course that I did in my last year of pharmacy school. And at that time, I was not planning on doing a residency whatsoever. It was not on my to-do list, but something just changed in me in hearing about the enthusiasm that they had for the coming year and what Isabel was going to learn in that year. And that just got me so excited for community pharmacy. And that's really the main reason that I decided to do a residency in general. So I'm so lucky that I landed this opportunity. Other than that, I grew up in Schnecksville, Pennsylvania, where the main site is for the residency at Weis. And I left to go to school up in Rhode Island. I left for, the 5 years plus the year of rotations. And for rotations, I chose to go out all around the country and do rotations, even as far as Alaska and North Carolina. And those were super meaningful experiences, but I wanted to bring all of that knowledge that I had learned and all of that experience back to my own community and to help the people that I know already, and of course meet new people as well. So the main reason I decided to do this program was because of the amazing preceptors and the wide range of activities that are offered as a part of this residency. So starting out with my preceptors, Dr. Nicole Pizzino is one of my main preceptors, and she is so involved in the community. I've never met anyone more involved, and she's just a great resource to have as someone who's still learning in the profession. But other than that, I have great preceptors at both Wilkes and Weis. So at Wilkes, I have the opportunity to work very closely with Dr. Kimmy Wynn at her ambulatory care site, and she is a fantastic preceptor in teaching how to give feedback and just be a preceptor myself. So I found that experience very valuable. Other than that, at Weis, some of my main preceptors are the folks in the pharmacy. So Stephanie Doyle and Lauren Hall are two of my main pharmacists that I work with, and they are fantastic. They answer all the questions that I have just as a new practitioner. I'm very thankful to have them. And otherwise, I work very closely with both Nick and Rick, who are the director of pharmacy and the vice president of pharmacy for Weis. So I'm getting a fantastic management experience out of this residency, which is something that I was looking for as I am interested in management in the future. But other than that, just everyone is so kind and helpful, all of my preceptors. So what does a typical day in my life as a resident look like? That is not a question that I can directly answer. I can more so give you a view at what my week looks like as a resident. So no day is the same, but I do have a general schedule for the week, and this is my personal schedule. It likely won't be the exact same as the future residents, as everything is kind of tailored to my interests and what I want to do in the future. So starting out with Monday, that's the day that I'm at Volunteers in Medicine, which is an ambulatory care clinic in Wilkes. And that clinic is very, very unique in that the patients don't have insurance and all the care that they receive is free. So that's my ambulatory care experience. I'm there all day long with Dr. Kimmy Wynn. And then later on in the day, I typically do some research for my research project once I get home at night. For Tuesdays, this is really a catch-all day. This is everything patient care, which makes it ever-changing. No day is the same. But some of the activities that I do is I, of course, do outcomes MTM, so that's doing tips and CMRs and calling patients and really educating them on their medications. Something else I do frequently is I work with associates from Weis on one of our associate wellness programs. So we have a Live Well with Hypertension and a Live Well with Diabetes program. So I do frequent check-in calls with patients, answer questions about medications and their disease states, and really dive in depth about what's going on with them personally in some of our check-in calls. I also help develop the content for that, and that is time-consuming as well, but very enjoyable. Another thing that I do is I work with students all the time. We have students at site, and anything that I do, I typically like to involve them in as well, as long as it aligns with their interests and their goals. But something we are doing this year is we are participating in the University of North Carolina Cardiovascular Disease Education Program. So this is a 6-month-long program where we educate patients once a month on cardiovascular disease and how to reduce their risk. So that was something that I saw a lot of value in getting the students involved in, as it's a lot of education and following up with patients repeatedly. So that's something that I typically do on a Tuesday on a patient care day. Other than that, I help out the pharmacy with vaccines. Always, if they need help, I'm always willing to help. What else do I do? I participate in PPC and payer contracts. So this is really exciting. These are clinical services that we provide. So sometimes I'll do social determinants of health screenings, or maybe I'll be checking in on some of our patients with asthma, seeing how they're doing with their disease state. Other than that, I prep for some of my DSME classes, so that would be diabetes self-management education. So I'll prepare for if I have any classes that week. I also am working on starting up my first DPP classes, or diabetes prevention program classes. So that is, a time-consuming but very exciting part of the residency. We're starting our first class very soon, and I'm very excited. Other than that, you never know what the day's gonna bring for a patient care day. Switching over to Wednesdays, I am a preceptor for the Wilkes University MTM IPB. So I hold about 4 hours of a session with pharmacy students, and we call patients and I coach them through that whole process, as well as provide feedback to them. It's been really great in my development as a preceptor in learning how to give feedback that is effective and meaningful to those students. And then in the afternoons, I'm doing all of those patient care things as well. Maybe I touch on my research project a bit more. Maybe I work on my quality improvement project or my business plan. On Thursdays, that's also a patient care day. Any of those patient care times, we can also be thrown in with a little bit of community outreach. So we do lots of activities out in the community, which is one of my favorite parts of the residency. But we go to a local senior center once a month. We go to an LGBTQ center and do vaccines once a month. We go all over. We do flu clinics, we do education, we go to schools and talk to people that are interested in maybe doing pharmacy in the future, all kinds of things. You never know what's gonna happen on patient care days, like I said. And then finally on Fridays, for me so far, this has been the day that I've done a lot of those DSME classes, but that's just the way it works with my schedule. So I'll have patients come in and visit me for about an hour at a time. We'll go through some information with them to educate them on their disease state. And then for the rest of the day, I'm in the pharmacy as a dispensing pharmacist, where I get to counsel patients, And it's a learning process for me right now, but very exciting. I try to involve students as much as I can while I'm there, do some OTC counseling, and of course all of the vaccines for the day. So the thing that I think is the most unique part of this residency is how customizable it is, and how much Dr. Bazzino is able to tailor the residency to the things that I'm interested in. So something that I'm very interested in exploring right now is my interest in management. So she has given me some of the freedom to work very closely with Nick and Rick on different opportunities, to go away to a conference that was really unique opportunity, NACDS, which is National Association of Chain Drug Stores, and the Total Store Expo. That was a really unique opportunity that I was able to be a part of. There was no one else my age there. I don't think there were any other residents. It was just very unique management experience. And that's one of the ways that we were able to tailor the program to my interests. But otherwise, one of the main great things about this residency that makes it unique is how much community service we're able to do. I have always been interested in community service. I've done it from the time I was a child with my family, all throughout high school and through college. I was a part of a community service fraternity. So it was really important for me to be able to continue on doing community service, especially as part of my job. So I really value those times that we go out into the community, to the community centers, to the senior centers, to schools, to do education. All of that is very meaningful to me and very unique to this program. My research project is tailored to something that I'm interested in, as I said multiple times, with management, and I'm interested in operations and things like that. So my project is actually on autofill, or automatic prescription refill. And what I'm doing for Weis is I am taking a look at what our current processes are for implementing autofill, and I'm seeing what ways we can improve that and seeing how feasible that is for specific stores. So I'm sending out a survey to everyone in the company to see what their thoughts are on my solutions that I'm proposing. So I receive a lot of support in my research project, especially because I don't have a background in research whatsoever. So Dr. Nicole Bazzino is a great resource in terms of research, but she's not the only one that helps me with my research. I'm very fortunate to be a part of a group called Top Tier. And what Top Tier is basically other residents in Pennsylvania. We've all gathered together with our preceptors to work on our research together. So we meet every other week just about for an hour, and we all go around and we talk about our own research projects, some of the struggles that we're having, and just things that maybe we need read over or opinions that we need. It's very helpful, and it makes us feel less alone in doing research, as it can be a strenuous process. So my business plan is that I'm hoping to implement COVID, flu, and strep testing at the site, the Weis site in Schnecksville, but eventually make that company-wide. So I'm gonna figure out all of the processes and procedures behind that, and it's very exciting because that was something that I was able to do as a student on rotation. So using those experiences to develop that into an opportunity for Weis is something that I'm very excited for, as it's not only a good opportunity for Weis, but also for the members of the community who need that easy access to testing. Accepting and Learning Program, also known as PLP, is a certificate program that we do as residents, and it's not only myself as the resident, it's also other residents local to the Wilkes-Barre area that I get to work closely with, and we meet about once a month in the evening. And we do lots of activities to learn how to give feedback to students, just how to be a good preceptor in general, how to make a syllabus, how to tailor the activities that we give to our students to what their needs are, and how to create meaningful activities for them. It's also a very flexible program in that if I was interested in teaching, there are so many opportunities that could be had to teach lectures at Wilkes University. Unfortunately, that is not something that I am interested in at all, is teaching large group lectures, but that opportunity is certainly out there. I see a lot of value in it though, for the ability to give feedback. Thank you for taking the time to learn more about the program and hear about my experience as the PGY1 pharmacy resident for Wilkes University and Weis markets. If you have any questions, please feel free to reach out to me via email.